Pressures in the cardiovascular system. Blood pressures are not equal throughout the cardiovascular system. If they were equal, blood would not flow, since flow requires a driving force. The pressure differences that exist between the heart and blood vessels are the driving force for blood flow. Mean pressure is highest in the aorta and large arteries and decreases progressively as blood flows from the arteries to the arterioles, and decreases progressively as blood flows from the arteries to the arterioles, to the capillaries, to the veins, and back to the heart. This decrease in pressure occurs as blood flows through the vasculature because energy is consumed in overcoming the frictional resistance. Mean pressure in the aorta is high, averaging 100 mmHg. This high mean arterial pressure is a result of two factors: the large volume of blood pumped from the left ventricle into the aorta and the low compliance of the arterial wall. The pressure remains high in the large arteries, which branch off the aorta because of the high elastic recoil of the arterial walls. Thus, little energy is lost as blood flows from the aorta through the arterial tree. Beginning in the small arteries, arterial pressure decreases, with the most significant decrease occurring in the arterioles. At the end of the arterioles, mean pressure is approximately 30 mmHg. This dramatic decrease in pressure occurs because the arterioles constitute a high resistance to flow. Since total blood flow is constant at all levels of the cardiovascular system, as resistance increases, downstream pressure must necessarily decrease. In the capillaries, pressure decreases further for two reasons: frictional resistance to flow and filtration of fluid out of the capillaries. When blood reaches the venules and veins, pressure has decreased even further. Because capacitance of the veins is high, the veins can hold large volumes of blood at this low pressure. Diastolic pressure is the lowest arterial pressure measured during a cardiac cycle and is the pressure in the arteries during ventricular relaxation when no blood is being ejected from the left ventricle. Systolic pressure is the highest arterial pressure measured during a cardiac cycle. It is the pressure in the arteries after blood has been ejected from the left ventricle during systole. Pulse pressure is the difference between systolic pressure and diastolic pressure. Mean arterial pressure is the average pressure in a complete cardiac cycle and is calculated as follows. Notice that mean arterial pressure is not the simple mathematical average of diastolic and systolic pressures. This is because a greater fraction of each cardiac cycle is spent in diastole than in systole. Thus, the calculations of mean arterial pressure gives more weight to diastolic pressure than systolic pressure. Do not forget to like the video and subscribe to our YouTube channel.